My name is Dr. Lillian Ouma. I work at the International Cancer Institute, where I head the Office of Clinical Research. I have been at ICI for the past 2.5 years.
Hello, my name is Anthony Mushiri. I'm a medical oncologist here at ICI. I've been here for the last 3 years now, heading to my fourth year. And well, the journey has really been fulfilling in every way. And I think the inspiring bit has been seeing these patients come in gloomy and then living out the glimmer of hope. I think for us, that has been the main highlight and inspiration every day that we come to this clinic.
Hello, my name is Liza Wina. I work here at ICI, International Cancer Institute, as sickle cell coordinator and also recruitment in terms of sickle cell clinical trials. I'm also a sickle cell warrior. I've been working at ICI for the past 1 year.
So my name is Mika Odoyo Omolo. I'm an oncology nurse at ICI, and I've been here for 1 month. I think I'm the last born here.
So for me, this is actually inspiring because with this, we are able to take part in potentially being part of the future of cancer care, not only in this country, but also globally. And this means that eventually, when we are now coming to formulate treatment plans for our patients, we get to take part in being part of that evidence-based care of cancer patients. So I really enjoy what I do at the International Cancer Institute, and I hope that from what we do, we are able to help more patients, not only in the present, but also in the future.
So my passion for working with sickle cell patients, it's because these patients, they go through a lot of pain crisis, and they're not even understood at their family setting. So when they come to ICI, we treat them with dignity, respect, and we accept them. And then what made me to love working with ICI, it's because they have new therapies for sickle cell disease. Like, for example, like for my case, I can attest to it that I'm the first patient in Africa to use crizanlizumab. So, and also we also have sickle cell support group, which is very important for their psychological support and also psychological help, where they feel like they're part of that family. So in ICI, we have a lot of activity that is catered for sickle cell warriors, sickle cell patients, and I really thank the ICI team for employing a sickle cell person, because most of organizations, they fear employing sickle cell patients because of the pain crisis that they usually get. So for me, that's a big win for us.
Additionally, the fact that I get to be part of a wonderful team, a highly qualified team, headed by the PI, Professor Chite, and also the entire team, including the clinical team and the research team, is a reason for me to wake up every day and come to work.
So I think my inspirations to work with the cancer patient has been, it was from a background, family background, because I had a relative who had cancer, and it was a big initiative from the family members who were telling me that I had to specialize in oncology for the sake of the relative. So it was something that I began even way back from high school. So after doing my nursing course, I went straight to specialization, and that is how I am here. So the inspiration is from within, it's deep within. Yeah, as much as it is a calling, it is also it's like a task.
Yeah, and we have had some highlights in terms of the patients we see. We have a number of patients we can even highlight and say that these are patients who are doomed to be done with their life. Say like for instance, an 18-year-old boy diagnosed to have osteosarcoma of the limb. This is an active footballer, very active also in school and doing well. Then the bad news comes in, and you can imagine the distraught in this family, and being told that now your life has to change, probably never play football again. and due to the diagnosis, even you have to shift from school to elderly and all that. And so, what is unique about us is that we have the multidisciplinary approach, and so we had surgeons come on board, we had pathologists, oncologists, and for this particular young man, we had to prepare him for the treatment, and we did what is called a neoadjuvant perioperative approach. And then later, actually, he had a limb sparing surgery, which is very rare in our scenarios. Most patients either have amputations, and for that, they're not able to live their previous life. So for this young man, for instance, he was able to do the chemo, then had the surgery, and then now he's on the rehab back to his prior sports activity. And that's just one of the examples of the highlights we have for these patients. And even others, say cases of breast cancer patients who have been condemned maybe to a stage 4, then they come to us for second opinions. We run more investigative tests, and we have a chance of giving them the best chance for cure. We even have some do the most intricate test that you'd want, maybe a PET CT, whereas they have not been recommended earlier. And you find for these cases, some people whom were deemed not to have options of treatment, you actually have a couple of things that you can even give them. Name it, immunotherapies, targeted therapies. And unfortunately, these are services some hospitals did not offer them as options of care. Not even without mentioning the options of clinical trials that we are offering as part of our standard of care for these malignancies. I think the landscape of oncology care is shifting, and the more options of care that we have for these patients is the best care that we can really offer to our patients. Because if I look at what inspires me, because at the end of the day, you have to ask yourself why you wake up and come and see oncology patients, yet it's a field that probably other people would shy off. You think about this patient, could be your relative, your brother, your sister, your mother, or anybody else. And when you try and contextualize it in that manner, then you find that inspiration to give the best options for these patients. I think that's why we do what we do.
So for my highlight, I can say that we've seen like 3 different sickle cell patients. One was from Homa Bay County. She used to go to the clinic, I think in Western Kenya, but she was always in crisis like monthly. So one day the caregiver reached out to me, and I told her how she can come to ICI and start the sickle cell clinic, because in ICI we have our sickle cell clinic every Monday. So when they came that day, then that child, she was 3 years old and she was in crisis. So the doctor took care of that child, and what we realized is that this child was not on a stable dose of hydroxyurea, PNV, and also folic acid. So she was started on a stable dose of hydroxyurea, and then she was given PNV, and then the doctor also recommended that she gets the vaccine that are very important for sickle cell patients, like meningococcal, pneumococcal. And after that she was followed up every month. Then after that, after 6 months, she became stable, and right now they have never heard about crisis. The child is stable, she's going to school well. I think that joy, we always like to see our patient smiling. That's when we feel like we are doing something to them, because they are a gift to us. And for them, it's because of them that we are here at ICI working for them. So for sickle cell warriors, when you come to International Cancer Institute, just know that you are on the right track. You'll be welcomed well. We have medication, vaccines, you'll never miss anything. And we have holistic care for our sickle cell warriors, and even for caregivers, because they are the forgotten lot. So even for caregivers, we know that you go through a lot of psychological issues, and here we shall support you. Thank you.
Where we aim to be as a research unit, we are hopeful that we will continue to be a research center of excellence, not only in the region, but also globally. And with this, we envision that we will be able to take part in a lot more clinical trials, including early phase clinical studies that are still very deficient in this region. We hope that once we are able to bring on board a lot more of the early phase clinical trials, then we are also able to generate data that is contextualized to our population in the early phase studies.
Yeah, so where do you see ourselves at SCI, and what is our ambition? So our ambition is to become a center of excellence in oncology care, both in training, in research, and even the treatment phase of things. And for this, we are looking at the whole continuum from the diagnostics, the treatment, survivorship. And you realize that very few centers are able to offer this holistic kind of care. And so it would be awesome if we would be able to offer all the services all under one roof. I'm speaking about all the therapies available, target therapies, immunotherapies, radiotherapy, even surgical therapy in itself, and not forgetting the component of clinical research. Because being pioneers of these clinical trials in oncology, then I would like to see us offering even early stage oncology clinical trials, and even extending our trials to other perspectives in terms of new therapies that possibly would be game changers. And for that, I see us becoming a training hub for these research fellows, for these oncology fellows, even oncology nursing practice, oncology pharmacy. Already we have started a few works in terms of curriculum development, but then I think the burden of disease in the country is too huge, and if you could just scratch the surface in terms of being the catalyst of change in this, I think that would be a plus. Not forgetting our patients. In terms of the future, then we'd want to offer what is really current, what is really precise in terms of the direction oncology is taking towards precision medicine. That is where we see ourselves offering the best targeted and precise medicine as possible. All right, and we try to keep our patients in very high spirits, and there's never a good diagnosis of cancer. People say these are good cancer, these are bad cancer, but in the real sense, the big C is a nasty disease, and the treatment itself takes a toll on these patients, and for that you have to really maintain them on high spirits for them to endure the whole treatment and even comply with the routines that are scheduled, because you can imagine being told that you'll be on your treatments for the next 6 months or even 1 year, and you as a patient must be looking forward to the treatments. And by this, us as doctors and nurses and clinicians, we have to see at how best can we maintain the spirits of these patients high enough to sustain their treatment and continue coming. And for us here, what we try to do, if you have ever visited our center here, is that we have a very stimulating environment. If you come and there's greenery and all that, not to add on to the very friendly stuff that you see. So we try, like I said earlier, think of these patients as could be a relative, your friend, or somebody else. You have to really, as much as they're your patient, you have to, I know it's a very thin line, but try to be very humane with them and try to remind them that life has to continue despite the treatments. And so we have support groups, we have navigators who help around these patients in the activities that are needed, and we have even some activities that they can do as patients who are getting the treatment that day, that will engage them and keep them more positive about life, because I think that's where most patients lose it, because you're trying to fight this disease, but then your mind, your body, your soul is totally in a different route. So basically for us is trying to see the best way on how we can maintain a positivity on activities, support groups, friendliness, and even the environment itself, and anything that can make the patient more comfortable and relaxed during treatments. That's what we do for them here.